Hi, this is Mike Elliott, and you're watching the Cannabis Financial Network. In this segment, we're going to be talking to Miss Betty Aldworth. She's the Deputy Director of the National Cannabis Industry Association. Good afternoon, Betty. Thanks for joining us.
Hi, Mike. It's my pleasure.
Betty, to start off, could you tell us about the National Cannabis Industry Association and what its overall mission is?
Sure. The National Cannabis Industry Association was formed by cannabis businesses, legal cannabis businesses, and currently represents more than 300 cannabis businesses in every state where they are legal. Those businesses might include dispensaries or cultivators. They might include the people who make the packaging that cannabis products will be provided in, or the people who make the cannabis products that are used in addition to the flower, such as topicals, lozenges, and other alternate delivery methods. We represent the accountants and the attorneys, essentially anyone who's involved in cannabis business. Our core mission is to provide equity for cannabis businesses at the federal level. So we work primarily on the issue of 280E tax reform and banking. As most viewers probably know, cannabis businesses are subjected to an effective business tax rate of about 60 to 90%. And in addition to all of the other struggles that come along with creating a business in a brand new emerging industry, cannabis businesses aren't allowed to bank at typical banking institutions, can't even have a checking account. Those are our two primary immediate focal points. We also work on eventually reconciling state and federal law as it relates to marijuana and marijuana-related businesses. And we provide some of those other resources of a trade association: networking, education, and information.
And next, could you give us a quick summary of where you think the U.S. medical marijuana and marijuana market in general is now and where it's headed?
Clearly, we are witnessing a sea change in our economic history. Never since Prohibition, the end of alcohol prohibition, have we seen an existing industry come out of, or an existing market rather, come out of the shadows and the underground market and turn into a legitimate industry. In this process, we have an incredible opportunity to capture not only the benefits of medical marijuana for the individual patient, which are tremendous, but also to capture the economic benefits of a legal market. Job creation, tax revenue generation, economic stimulation for local communities and cities and towns. In Colorado, in fiscal year 2012, it's estimated that about $8 million in taxes. Sorry, I'm going to start over just from in Colorado.
Yeah, no problem.
In Colorado, in fiscal year 2012, more than $5 million, nearly $6 million in taxes was generated just by the state. And in fiscal year 2013, that's estimated to be more than $8 million. You can double that for city and local taxes. We have more than 5,000 jobs in Colorado that were created by the medical marijuana industry. And I use Colorado as an example because we have the best numbers here, but we're also starting to see some of the same data coming out of other states where we're seeing the real economic benefit of taking this market for either a very popular adult product or a medicine that is changing people's lives, and we're creating from it the kind of industry that we can all support, as opposed to empowering the black market. So today we stand at the precipice of an enormous boom in innovation. If someone could have stood at the beginning of the tech boom and said, here's what we can expect to see from the future, that's where we're standing right now. And this is some estimates have said this is a $50 billion annual national market. Some estimates have said it's a $100 billion annual national market. It's very difficult to say right now how the public appetite for medical or adult use marijuana products will change, but we know that it will. We're seeing tremendous innovation in terms of the types of products that people can use. I expect to see that the nutraceutical market, the wellness products market, is actually going to eventually be larger than the adult use recreational market for marijuana and marijuana products. And eventually, we're going to see the full proliferation of responsible adult marijuana-related tourism and other businesses that none of us can even imagine today.
And you mentioned, so maybe this might be a bit of a repeat, but you recently worked on Colorado's campaign to regulate marijuana like alcohol, where you discussed legalization, taxation, and regulation. Can you tell us some of the similarities and differences between regulating alcohol and marijuana?
I think one of the most interesting similarities between alcohol and marijuana is the way that they're treated legally, or similarities and differences. During alcohol prohibition of the 20s and 30s, we saw the government endeavor to, to end production of alcohol, and that simply didn't happen. The entire alcohol market was relegated to the black market, empowering criminals, creating, what we would call today cartels, creating a situation where adults who were otherwise law-abiding, otherwise rule-following, and otherwise responsible were forced to break the law in order to acquire a product that they desired and weren't going to stop using simply because it was illegal. And we find ourselves in a very similar position today, where the production of marijuana, the sale of marijuana, and in many places the personal use or possession of marijuana is illegal. And we are empowering these enormous cartels. We are giving our hard-earned dollars, our hard-earned efforts to criminals, and we are also, we're spending money on eradicating marijuana, on completely fruitless efforts to eradicate marijuana in our communities, that could better be used to do responsible regulation, to do responsible education, to ensure that marijuana isn't ending up in the hands of youth, to ensure that the people who are working in the marijuana industry are doing so with good faith and following responsible practices. We see that in Colorado and Washington today. The industries that are developing in these two states are incredibly tight-laced, incredibly strict, and are going to eventually, I think, follow the standards of a federal regime of some sort that will someday address the differences between state and federal law.
And so, after working in Colorado towards successful legalization, where do you see national efforts heading over the coming years?
So those organizations that work on changing law statewide, organizations like the Marijuana Policy Project and the Drug Policy Alliance, have clearly stated what their goals are. They expect to see by the 2016 election 10 more states with adult use marijuana laws on the books, much like Colorado and Washington, where we're taxing and regulating marijuana instead of pretending like it's a product that we can eliminate from our communities. They have stated very clearly that that's the goal. I think that those are achievable goals. We see in countless polls and in many demonstrations of support from the voter to the state house that there's an enormous appetite for changing marijuana law these days. People are sick and tired of punishing adults for using marijuana. People are sick and tired of wasting resources on practices that are not in any way actually reducing the use of marijuana in our communities, such as using the criminal justice system to try to enforce marijuana laws. And I don't think that the people are going to stand for it much longer. I think that we will see in the very near future many more states with similar laws, and we know certainly that we will see many more states with medical marijuana laws on the books. And it's important to note that that while we're talking about the same product, the importance of medical marijuana laws and medical marijuana being accessible and available to patients who need it, I think really cannot be understated. We are moving to regulate adult use markets in many of these states, but the fact of the matter is there are still millions of Americans out there who desperately need access, safe, legal access to medical marijuana, and that fight can't stop.
And Betty, that's all the questions we had time for today. Were there any other comments or anything else you wanted to add before we close?
Thanks so much for having me on today, Mike, and I look forward to being on again.
Betty, thanks again for your time. Likewise. We have been talking to Miss Betty Aldworth. She's the Deputy Director of the National Cannabis Industry Association. To learn more about them, please visit their website at www.thecannabisindustry.org. Thank you.